Hello, and welcome to this edition of Joint Action. This podcast is dedicated to all those out there who have osteoarthritis, aka crumbly joints. On the show, we unpack the truth and demystify the myths about the disease and its management. If you have joint pain and want to know more about how to manage it from the world's best experts, you have come to the right place. Without further ado, it is time to welcome your host, David Hunter.
Hello and welcome to this edition of Joint Action. This week we have the privilege of discussing why does it hurt? And we're joined by none other than Jason McDougall. And Jason's lab employs an integrative approach to examine the role of nerves in controlling joint inflammation and pain. His lab uses a lot of different techniques to record the function of nerves, to investigate their activity in joint-related conditions. His aim is to identify novel drug targets to help relieve joint disease, inflammation, and pain. And he's got a lot of different research interests, including arthritis, pain, inflammation, receptors related to that, and specific agents, including cannabinoids, which we will hopefully get to as part of this discussion that he's quite interested in. So Jason, thank you so much for coming along.
Thank you, David. It's a pleasure to talk to you about this.
Yeah, it's a challenging time, and I'm sure you're experiencing this in Canada. What sort of impact is the virus having on your day-to-day life and your lab and your family?
Well, it's having a huge impact, of course, like with everybody. Basically, the lab is shut down and nobody's doing any experiments. We're all in lockdown at home, working on papers, maybe trying to catch up on some reading and coming up hopefully with the next best ideas. So it's been very difficult to be remote from my lab members, from the team, also other people in the department. It's having a huge impact.
Yeah, and how are you staying in contact with your group?
So regular emails, try and keep it light, have a little bit of a joke, the odd Zoom meetings, things like that. That's just trying to keep in contact and keep the morale up as best as we can.
Yeah, and I see you're resting in a very comfortable chair with a nice sheepskin down there in the basement. Is that getting a lot of use at the moment?
It certainly is. This is my new office. Very, very comfortable. The sheepskin's keeping me warm and keeping me company during these cold days. So yes, this is where I do my work from now.
Oh well, stay well, stay safe, and I wish you all the best for this really challenging time.
Yes,
so
thanks.
We might get in and start talking a little bit about the topic at hand. Why does it hurt? But in the first instance, I just want to learn a little bit more about you. And so if you could describe yourself in 5 words, what would they be?
Well, that's a difficult one. I'm a very private person as well, David. I have a good sense of humor, maybe try and keep quite upbeat. I have compassion for what I do and the people I work with. Let's see, 5 words. I'm enumerate. So that's probably 5 cases right there for you.
Oh, brilliant. Thanks, Jason. And can you just expand a little bit more and just tell me a little bit more about what your research is on and what your group is focused on?
So we're really just trying to work out the complexity of osteoarthritis and joint pain. As you mentioned in your kind introduction, we have many different approaches to try and understand what's causing the pain within the joint. So we do anything from very simple neurobiology of trying to understand how those nerves work, how they sense the pain, how they transmit the pain to the brain, how we interpret those signals, and then trying to understand what different targets we could go after and develop new drugs to try and stop those signals getting from the joint into the brain. So hence, managing the pain.
It sounds fascinating. And I guess in the first instance, just trying to put an overarching framework behind our understanding of pain. There are a lot of different frameworks that are out there, but is there a particular framework that you subscribe to that might help our listeners understand where pain comes from?
Well, pain is extremely complex. It's not something we like to talk about. And there are many different psychological and social issues that contribute to what we all feel as pain. There are many different types of pain. So pain is not pain is not pain. There's what's called nociceptive pain, which would be, for example, you're touching something hot or you're standing on something sharp, that very immediate alarm system in your body. And that type of pain certainly is a component of joint pain. When maybe bones are rubbing against each other, it's that alert system that something is not quite right in our joints. Another type of pain is inflammatory pain. So where there's inflammation within the joint, various different chemicals are being released into the joint, which can then sensitize those nerve endings in the joint and give us that heightened feeling of pain. And then more complicated is something called neuropathic pain, where there's actual damage to the nerves themselves. And we're finding that in patients with osteoarthritis and in some of our models, disease models, those nerves don't look normal. And the fact that they're not normal means that they're responding differently and they're also contributing to pain. So it's a very complicated interplay between these different processes that we're interested in.
Fantastic. And if a person was, and it's obviously variable between people and within a person themselves, but if we were to try to distill down what the main drivers of that pain are, of the factors that you just spoke about, whether it be inflammation, nerve damage, mechanical loading, the psychological and social factors that you talk about. Again, I'm probably making it hard for you, but if you had to try and identify of those, which is the most important, can you put your finger on it?
No, because I think they all play a major part. And you're right, different people will have different components to their pain. Some people may have more of this neuropathic type of pain. Other patients might have more of an inflammation, but certainly I couldn't put my finger on one being more important than the other. They all contribute to this crazy syndrome that we call joint pain.
Yeah. And if you could just expand a little bit on when a person is walking around and they're feeling pain in their knee, their hip, or their hand, where do the signals for that pain start and how do we process them?
So part of it probably comes from the loading of the joint. So when we're walking around, those nerves become hypersensitized. So even normal types of movement is now amplified. And the brain now interprets those increased signals, those electrical signals coming from the joint that we would normally just think of as normal movement, as really quite painful. Also, the joint tries to repair itself. So if it's been damaged, it's been injured, if it's got some underlying disease, it's going to try and repair itself, which is great. But unfortunately, the mechanisms that are involved in that and some of the chemical mediators that are involved in trying to repair those joints can have a detrimental effect. They can sensitize those nerves, leading to heightened feelings of pain as well. So yes. There's a mechanical component, there's a chemical component, even just the gradual breakdown of the joint tissues, like the cartilage and the bone, etc., release various chemicals, which themselves can also sensitize those nerves, leading to the pain phenomenon.
Yeah, and we'll touch upon those chemicals in a moment in terms of treatment targets specifically. But before we get onto that, just a couple of words, if you could just explain a little bit further about the psychological, social, or contextual aspects that might influence a person's pain experience.
Well, we all deal with pain very differently. Some people may be able to cope with joint pain better than others. So there's that psychological component comes into it. It has a devastating effect on people's quality of life, and not being able to work, not being able to, hold a child, or it really impacts our physical activity, and that really impacts on an individual's well-being. And over time, if there's a detriment to the well-being, they may feel more pain and not being able to cope with it as well. So it's not just the neurobiology that we try and look at, but also that you're right, that whole psychological, social component to pain is also very important and very, very complicated.
Yeah, and I think just to re-emphasize all of what Jason's saying there, I think the critical message there for people who are out there who have pain is if you're depressed, if you're stressed, if you're anxious, if you're socially isolated, if you're in the process of losing your job, potentially as a consequence of your joint disease, it's going to have an impact on your pain experience. And so our ability to treat and modify your pain using some of the treatments that we have at hand are great, but they're limited if we don't address some of those other important elements that might accentuate your pain experience. If you could just, I guess, briefly touch upon some of those treatments and how they might work on pain, particularly those that people might commonly be used to using, such as anti-inflammatories and opiates and other agents.
So certainly there's no great way of controlling pain, and what might work for one individual may not work for another individual. So from a drug point of view, of course, the first go-to drugs are the non-steroidal anti-inflammatory drugs. So some of these anti-inflammatories, which can be great. They have obviously known side effects associated with them on our cardiovascular system, on our heart, also maybe on our kidneys and our stomachs, etc. So we really need to find better targets or better ways of trying to control the pain. Then we get on to use of opioids. Opioids, again, very effective for controlling pain. They're very beneficial, but of course there are a lot of known side effects associated with taking opioids, and I know a lot of people are probably afraid of taking opioids for fear of things like addiction or tolerance. But I think in a controlled manner, opioids would still play a very relevant role in helping managing pain for certain subsets of patients.
For anti-inflammatories, if we just want to pick that one up first, how do they modify pain? Are they actually targeting inflammation within the joint, or do they work predominantly centrally? How is it that they work?
Well, really both, actually. They can dampen down the inflammation that's occurring within your joint, and maybe reduce some of those chemical entities that I was talking about that can sensitize the joint nerves. But there are also receptors on the nerves, so things that these non-steroidal anti-inflammatory drugs can bind to, and can dampen down the signals being transmitted from the joint to the brain directly within the joint. But you're right, they can also act in the central nervous system, for example, at the spinal cord, where we know a lot of the pain signals can be amplified. A lot of these anti-inflammatory drugs can also work at that level to try and tune down, and like turning the volume down on your music system, to prevent that transmission of the pain signals getting into the brain. So they really work at multiple different levels.
Yeah, fantastic. And we'll have an episode coming up in a few weeks about the different pharmacologic agents that are helpful in the use of treating pain for osteoarthritis. So, for many years, I think a lot of people have spoken about the fact that many of the agents we do use are modest in their efficacy in terms of relieving pain, and they have a range of known side effects related to them. So as a consequence of that, pain, I think for many is still an unmet need. And so I guess just asking you the pointed, loaded question, do we need more analgesic agents for osteoarthritis?
I think so, yes. I believe that we need more targeted agents that can control the pain in a very, as I say, efficacious, very potent way, but also in a very safe way. And maybe not just be one drug at the end of the day, but maybe a combination of different drugs that's going to help try to relieve that pain, and at the same time trying to mitigate or minimize some of those nasty side effects that we sometimes associated with current drug therapies.
Yeah, and hopefully, obviously, in time, targeted towards the typical types of pain that you spoke about before, depending upon how a person presents, whether that's more inflammatory or otherwise. Of the agents that you're aware of that are under development, which to you look most promising?
So for new agents, there are a few areas that are up and coming, that are looking very promising. There's something called nerve growth factor. So this is a chemical that's produced in our bodies that helps our nerves to grow and communicate with each other. But what happens is in certain disease states, like in osteoarthritis, these nerve growth factors start to go out of control. And instead of just having the beneficial effects of helping communication or nerve growth, they're actually again doing this sensitization of the pain sensing nerves within the joint. And there's been development of various drugs, antibodies that can reduce the activity of this nerve growth factor. And that's been shown to be very, very effective and at controlling pain. There are still some issues associated with this particular nerve growth factor antibodies, but that's looking very promising. Another area as well, and there's a lot of anecdotal evidence, of course, and something that we have an interest in, is cannabis. And people have been using cannabis for thousands of years for many different indications. But there's this stigma associated with the use of cannabis, and very much a social stigma associated with it that we maybe have to talk about and try and overcome. But I know a lot of patients that I talk to seem to gain a lot of benefit from taking certain types of cannabis, not only just in being able to manage their pain, but also helping with anxiety and the stress of living with these chronic diseases. So that's another area that we're very interested in.
Yeah, it's an area of active interest for lots of different researchers in the osteoarthritis space, and obviously, as you say, anecdotally, a lot of patients out there have a strong interest in cannabinoids as well. If you could just briefly distinguish between THC and CBD and just explain those terms, and I guess also just touch upon what part of cannabinoid process is likely to be most active and efficacious, and I guess make comments about the merits or benefits of smoking marijuana versus using a CBD targeted agent.
So cannabis is a very complicated plant. There are hundreds and hundreds of different chemical entities that are in cannabis, and we're only just scratching the surface of understanding what those different cannabinoids are and what they can do. So the two main ones that are investigated are THC, which is tetrahydrocannabinol, and that's the psychoactive part of cannabis. That's the part of cannabis that gives the feeling of euphoria and highs, but has also been shown to be very effective at controlling pain as well. And then the other main component is cannabidiol or CBD. And CBD is non-psychoactive. It can make you feel a little sleepy, but it doesn't have that euphoric effect associated with it. And the cannabinoids not only can control pain, but they can also reduce inflammation. They've been shown to be anti-inflammatory. So there is a lot of good scientific evidence as well on the cannabinoids, showing that they have anti-inflammatory properties. And also there's a little bit of evidence to show that it could maybe even help repair damaged joints and repair those damaged nerves that are associated with arthritis. So they can work at many different components of the disease to reduce the pain.
Brilliant. And we were lucky enough to have you down here relatively recently visiting, and you gave an amazing talk about cannabinoids and some of the history related to that. How long have these been used for various purposes?
Well, again, they've been used for thousands of years. They were part of the pharmacopoeia in the early part of the 20th century. Doctors were prescribing these drugs. There were many different medications that had cannabis in them. And then the stigma started to overtake the science. There was a lot of research and development previously, but then the stigma started to overtake it, and a lot of those programs, unfortunately, were shut down. Thankfully, we're starting to come through the other end with some really good science to show that there is something behind the cannabinoids and the cannabis plant that could be beneficial. But again, it's not for every patient. Not every patient is going to gain benefit from use of cannabis, but it's trying to identify those patients and using them in a responsible and safe way.
Yeah, brilliant. Now, Jason, what wasn't I smart enough to ask you about that I should have during our chat today?
Well, if we could just maybe expand a little bit further on the cannabinoid system. So there are also what are called endocannabinoids. So we talk about cannabis and smoking cannabis, and of course smoking is not the most ideal way of administering any drug, and using, like you said, targeted creams that maybe have cannabidiol in them, maybe in the future the way to go. But our bodies also produce their own types of cannabis, say these endocannabinoids. we're probably familiar with endorphins. So, we go running or we eat chocolate, we do things that we enjoy, we get a release of endorphins in our body. Well, there are also similar sort of cannabis-like compounds that can also have those beneficial effects. Now, the problem with the endocannabinoids is that they don't hang around the body very long. They're broken down very, very rapidly, and so they can't have their beneficial effects. And one of the strategies that we and others have been looking at is thinking of the enzymes that break down those endogenous, those naturally occurring cannabinoids in the body, and allowing our body's natural endocannabinoid system to take over and a more of a natural sort of way or endogenous sort of way of controlling the disease and symptoms.
Yeah, sounds brilliant, really promising. So hopefully we'll see more of that. Are there any patient-friendly resources that you might like to point us in the direction of that we could share with our listeners?
Yes, and I know in Canada here, where the Arthritis Society, they actually took the bold move of wanting to put some funding into cannabis research when it had that great stigmatization associated with it, and they wanted to inform their patients in a responsible way about the effects of cannabis and cannabinoids. So the Arthritis Society in Canada has some really good resources that are very patient friendly.
Superb. I might grab that link from you and put it on the show notes after the call. What's your biggest challenge in your role right now, and how are you going to overcome it? And obviously, we have the virus challenge at the moment that's making lives difficult for everybody. But I guess specifically from a research and pain perspective, what's your biggest challenge and how you're going to get over it?
It's the same old thing, unfortunately. It's needing funding to be able to run the research. It's extremely important that we have very good science, very robust science being done, that people can trust the science that's coming out. And in order to do good science, and we really need to have research dollars to be able to come to some great conclusions to help everybody.
Yeah, and I'm really hoping that in the current climate, where we've seen the importance of healthcare and research, that I think people's appetite toward research funding will improve. But if you could do anything, again, COVID virus aside, if you could do anything to improve health and healthcare, what would it be?
Well, I think, once again, we need good, solid scientific information coming out, access to drugs for patients, affordable access to drugs for all patients, I think is paramount. Those are the things that I see are going to be important to try and help beat these diseases.
Yeah, I think as you touched upon, equity is a big problem everywhere. And I think particularly when we're talking about access to cannabinoids for conditions in which they've been proven to be effective, their cost right now for many countries is extraordinarily prohibitive. But if you could remove all barriers and constraints to your pet favorite project, what would you do?
That's a difficult one. We have, it's not just the cannabinoids that we're interested in. We're interested in other different chemical mediators that are responsible for pain. Access to patient data, access to patient information. I gain more information sitting down and talking to an arthritis patient than I do with some of my scientific colleagues. So dissemination of information at all levels and active participation of arthritis patients in research, I think, is paramount.
Brilliant. And I guess just in closing, just a couple of quick questions, but if you could have a billboard with anything on it, what would it be and why?
Yeah, that's a good one. If there was a billboard that I would like to see, it would be, "You are now leaving osteoarthritis Painville, population 0.
Superb. Yeah, well, a cure hopefully is on the not too distant horizon for many of us. But if you could leave our listeners with a bit of advice, knowledge, or wisdom, what might you like to say in closing?
Be active, be positive. We've talked a lot about drugs today, but one of the important things is to maintain a good exercise regime, good, the classic be healthy, good diet, not to ignore your pain medications, because as we've mentioned, they're not just there to help control the pain, but they can also have other beneficial effects like reducing inflammation, maybe helping repair the joint, and improving the overall well-being of people living with these chronic diseases.
Yeah, really sagely and important advice. So, Jason, thank you so much for your time, your thought, your wisdom on our chat today. It's greatly appreciated.
Thank you very much, David. It's been a pleasure.
Yeah, and stay safe and stay well in these challenging times. So, for our listeners, that's all for this episode of Joint Action. Between now and next time, please do take care of yourself, stay strong, stay active. Please send us questions. If you have any feedback for the show, don't hesitate to let us know. And thank you so much for continuing to listen.
Thanks for listening to Joint Action with David Hunter. If you like our show and want to know more, check out www.jointaction.info. Don't forget to subscribe to the podcast and share it with your friends and family. And please leave us a review on iTunes or your favorite podcast platform. If you have any questions, you can email us at hello@jointaction.info and follow us on Twitter @jointactionorg. This podcast was hosted by David Hunter, edited by Vicky Duong, music produced by Jordan Hunter.